Hello! Hey, this is Dr. Hill from Rayford Animal Wellness Clinic, or ROC, where pets aren't just cool, they rock. So happy you're joining me. I am going to do a quick talk on non-steroidal anti-inflammatories. I'm super excited. I don't know about you, maybe not quite as much, but hopefully. So non-steroidals are such an important fundamental part of what I do every day. I prescribe them multiple times every day to young animals, old animals, everything in between, and they can be wonderful. They can really help quality of life. They can really do amazing things for us as well as our pets. Somebody's coming in and one of my dogs is very upset. But these medications sometimes, rarely, but sometimes can have serious side effects. So it's better if you are prepared, if you're giving them, so you kind of know what to watch for and can stop them early if you see anything that you think may be involved with a side effect with the medication. So most commonly, we're going to use these after surgery in older pets that have arthritis, so they're going to be on it chronically. Or just some acute pain, like they were playing and got hurt, right? And we're gonna try to give them some relief until there's healing. So those are the most common reasons that I might send a non-steroidal. And just like with people, most pets do great. They don't have any problems with it. It's usually for a short period of time and their body can handle it no problem. But every once in a while, there is an individual that cannot handle these medications, do not do well on them. But if we know how they work, we kind of can be prepared and know what we need to do if we start to see any side effects. And usually it's stop the meds. Stop the meds and they're usually going to improve, luckily. But you want to be on top of it, you know what I mean? So, how do they work, right? A non-steroidal works on some of the chemicals in the body, right? And so if you say slam your hammer onto your thumb, your cells release cyclooxygenase, COX, okay? And COX is an enzyme that promotes prostaglandins. And prostaglandins are what kind of mediate pain, inflammation, and fever, right? So we don't like that and we'd like to decrease that. And so the meds do great with that. The problem is prostaglandins do some other important things. They support blood flow to the kidneys. They support the protective lining of the stomach and intestines, and will help with clotting for your platelets, right? So if you're going to have a side effect, it could be due to those extra effects of the prostaglandin that we're really not trying to stop. And some non-steroidals do a better job than others. And so your pet may do great on one and not another one, just because of the different ways that they kind of stop that cycle, that pain cycle that the body goes through. So important to know, good stuff. So what side effects am I asking you to look out for, right? Or you could see. Well, if the stomach lining's upset, right, you're going to see vomiting, diarrhea, you're going to see them kind of just feel blah, not wanting to do their normal stuff, and just not feel good. And so if you see those things and they're on the meds, obviously stop them. Please let us know. We may need to do some lab work and just make sure everything's okay. But that's the quickest thing. Especially, I'm a little more worried, especially if you see blood and vomit or diarrhea, because that means we've really upset the lining of the stomach or intestines. And with the kidneys, you just see that blah kind of feeling, right? So those are the things, and maybe the vomiting and diarrhea, but so those are the big things to watch for. If you see them, stop the meds. Another possible side effect, which is very rare, is there are certain individuals that, for whatever reason, we don't know why, have developed liver failure due to non-steroidals. Now, it doesn't really make sense, and we wonder if the immune system gets involved. This is usually after long-term use. So one of the reasons that these kiddos that are on it for arthritis or older patients, we need to check that lab work every 6 months. So just know that's the best idea. I like to check it before we ever even start, because if there's some problem in the liver or kidneys or anything before we get started, we're much more likely to see problems. But definitely after being on it for 6 months, we want to check those values and make sure that everything's looking okay. Having said that, I've had older pets on non-steroidals for years. They really needed it for their arthritis. Their quality of life was a million times better because of the meds. And I think they can be very important and very helpful. But I do check that lab work every 6 months. And with one of them, he did have some values increase. The meds were helping him so much, we kind of waited it out and they went back down to normal. So it can be very helpful. And there are some newer non-steroidals that work way further down on that pain pathway. And lower down, they're less likely to cause kidney problems or stomach problems. And my dog Dottie now is on the newer of these medications called Galliprant. I've been very happy with it so far. So we do have all kinds of options. Those newer ones are more expensive, as I know you expected. And so it's definitely something that we could talk about for your kiddo if they need to be on pain medication to decide what the best choice is and the safest choice. Because like I said, they tend to do very well on them. We just need to really monitor that lab work to make sure everything's okay. So some other things to watch for. Well, we mentioned the liver. If you see yellowness of the eyes, like the whites of the eyes turn yellow, the gums, or the skin, okay, stop. And you would think, well, they're going to be sick if we see those signs, right? That's what I thought. Until years ago, I saw a dog show up happy as ever, but as yellow as could be, and values through the roof, stop the meds, and she did great. So there are some times that if you see the yellowness, stop. Even if they're acting completely normal, there's something very wrong and we need to get some lab work and figure out what we can do. So that kiddo did great. Like I said, stopping the meds was the key. So some other things to remember. Please don't give over-the-counter non-steroidals to your pet. If you have to, for whatever reason, let me know, or your veterinarian, and let's get the correct dose and make sure we're giving a smart, safe choice, the safest that we can do. These over-the-counters are more likely to have the side effects I just mentioned. That's why we recommend the prescriptions. But I have used them in certain instances, being very careful, monitoring very carefully, and with owners knowing what those possible side effects were. Cats, never, ever, ever give a non-steroidal to a cat without a veterinarian supervision. There are only very, very incredibly rare cases where we do that. Their kidneys cannot handle it. There are about 2 non-steroidals I have used in cats, Onsure being one, and there's another one, Medicam. But again, we are very, very careful monitoring lab work. Sometimes these things are needed, don't get me wrong, for the pain of arthritis and the quality of life, but we have to be very, very careful, in particular with cats, because they do not handle it well. And obviously, it's very heartbreaking when somebody's trying to help and they end up doing worse. So I did lose a puppy because a mom gave it Tylenol and it could not handle the Tylenol and unfortunately passed. So it is really important that that you allow a veterinarian to help you make those decisions, please. So back on to happier things. So that is incredibly rare. Please keep that in mind. Incredibly rare for the prescription medications used appropriately. So that's I think what I've got. Oh, don't give multiple non-steroidals together. So only one non-steroidal at a time, and do not give non-steroidals with steroids. So do not give them with prednisolone, prednisone, or dexamethasone. There are a few others. Just let your veterinarian know. We try to keep a really good log of everything, but maybe you haven't gotten it in a long time. They've been on it chronically and it just doesn't come up on the list immediately. So that's great for you to know as well what the meds are that we don't want to give together. So, so good stuff there. I'm trying to think if there's anything else. Again, they tend to do great, but it's great for you to know kind of how things are working, what it's doing, and to be prepared for any side effects, because the best way to deal with it is the lowest effective doses of things, so the very lowest amount you need to give, and then monitoring and stopping immediately if any side effects are noted. All right, that's all I got. Thank you guys so much for listening, and hope you have a great day and hope to see you soon. Thanks. Bye.